It's so for a therapist, you have to know how to soothe and ground, right? You have to playfully soothe and ground. You have to know that. You have to know the protocol very well. You have to know how to prepare a child for that protocol, preparing them for, do they know their emotions, their body sensation, what thoughts, right?
In this video, I'm talking with Beckley-Forest and Annie Monaco about doing EMDR with children. We will talk about the healing power of play, on how to adjust EMDR when working with kids, and how to integrate EMDR with play therapy. We will talk about creative ways to be playful when working with children, and how to get the parents involved when children do their EMDR work, especially in the reevaluation and closure phases. And toward the end, we will talk about the importance of understanding attachment and dissociation when working with children. And we will talk about courses that Anne and Annie teach and some consultation and how to be a better EMDR therapist when working with children. Here's the interview with Anne Beckley-Forest and Annie Monaco. Anne Beckley-Forest and Annie Monaco, welcome to the Art and Science of EMDR, and thank you for joining me.
Thank you. Thank you. Nice to be here, Rodham.
Yes, we're excited.
Yeah, so I invited you to the show to talk about EMDR with children and the integration of EMDR and play therapy, which is your specialty. And I want to start our conversation by talking about the healing power of play. So before we even get into play therapy and EMDR, why is play so essential for healing?
Let me start with that and then I'll let Annie jump in. I was a play therapist before I learned EMDR. To me, this is natural to understand that children, the way they acquire information, both adaptive and maladaptive information, is through experimentation. So play is the experiment. And if you want things to make sense to kids, you have to get their hands on them, you have to get their bodies moving. This is certainly true in education, but it's even more true, I think, in psychotherapy, because we're trying to touch on a lot of things that maybe are not easy to put into words, especially for children who don't have that developmental stuff on board yet to be able to do that. So that's a natural fit for me.
Yeah, and I was learning play therapy, but at the same time, I got trained in EMDR pretty early in my career. And so what I was finding is that I would do EMDR in an adult kind of way with the kid, and then they would say to their parents, "I don't want to go back there. That lady's doing that thing to me," and it wasn't playful, it wasn't fun, it wasn't developmentally appropriate. So that was when I was really like, we have to find different ways to reach children, which is really then how I started to work with Dr. Ricky Greenwald, because he was one of the first trainers of EMDR with children. And so it was through him that I started understanding more how to deliver this protocol and make it effective.
Yeah, and your book actually starts with stating that a lot of times if you don't do it right, children don't want to do EMDR. Therapists, or the way you phrase it, I like the way you phrase it, they don't want EMDR to be done to them. So how do you do that integration of play therapy and EMDR, and why is it so essential, or why is it so effective when you integrate the two approaches?
Well, one thing is, I think when some kids can do the adult protocol,
Mhm.
like the very sort of orderly, anxious, well-behaved ones can, but it feels superficial to me. It feels oftentimes that they're not getting into the emotional material. They're not really in the traumatic memory network. But in play, even when kids are not deliberately talking about the traumatic experiences, they're often pulling from those experiences. And so, there's lots of different ways in which we can use that. We can direct it, in terms of like if you want to, install a resource, or you want, kids to feel bigger and stronger about things. It doesn't make sense for a 6-year-old to sit and imagine that when they could be,
Yeah.
running around the room being a superhero, because that's going to be their way of taking that experience in a more age appropriate way. So there's many examples of how to do it, and some of it comes from children. Sometimes they're already in the network of associations, and it's our job to sort of say, oh, this is a good moment for the protocol. And of course, I have to know the protocol really well in order to be nimble in this way, to just kind of jump in and invite kids to do some of that work. So,
Yeah, and I think what I want to add to that is, we have to understand that doing EMDR trauma processing with a child is not 55 minutes, right? So a child can't do that, right? Like I think when I say that, it makes sense to people. And so, for me, it's integrating, we might be, I had a child last week, a 7-year-old who really came in and just was putting it out there. He wanted to work on a trauma from when he was in foster care. And it surprised me, but I had done a lot of preparation work. And yet, in between sets, he was doing things that I taught him to ground himself. He was bouncing on my yoga ball, he was playing with fidget toys. And, it was surprising to me, that's kind of one of my first rules when I start with kids is you have to, if I bring up something that's really hard for you, you have to play, which then also gives the message to parents, right? That this has to be playful. So, that playfulness, that having materials and toys for kids to be able to do both, like Ann said, RDI and trauma processing is crucial to make it effective.
Yeah, Annie, I have to say, so I don't work with kids, but when you say bouncing on a yoga ball and all these other things, it sounds really fun.
Yeah, come on,
And
come on.
I'm wondering if, how much of these techniques can we apply to working with adults? That what we learn that works for children can be applied to doing EMDR specifically with adults, because, you know, um, and said that, sometimes kids don't get into the memory networks, and that happens with adults too, right? They're kind of like staying in their left brain and their rational and not into the emotion. So I'm wondering how much of that can we apply to our work with
Sure.
adults when we do EMDR.
well,
Yeah,
I don't have a separate office for adults. I do see
yeah,
adults, and so they're in my same space as the kids would be. And for me, the big difference is about being in the body and about movement.
yeah.
And I really, and Annie was my trainer for EMDR 11 years ago. And even 11 years ago, Annie was already talking about how you got to move the body. And really, EMDR is such a somatic, um, approach.
Yeah.
But the therapy room that has toys and materials and things that you can touch and hold, and a sand tray and art supplies, there's just a lot of, if you have it there, then it's so much easier to cross the bridge into doing it. Um,
Yeah.
so I
Yeah.
think it's an advantage that way.
Yeah, absolutely. I like that word advantage, right? Because, then it does bring out the playfulness in adults. And I will say to you that, some parents of kids, I had a kid one time who the whole family had a horrific car accident, and dad would not talk about it, but he was willing to come into a session to listen to his son talk about the car accident. And so we did it in the sand. And all of a sudden, the father's like, here, let me put a few things in the sand about the car accident, right? And so you see this, man just trying to get involved and really started to touch a memory that he had struggled with. But we know that in order to help kids, we have to have parents on board too to be able to do some of this work. So, but I use many art materials with adults. It's not out of the question. Some adults absolutely engage it quickly. Others kind of just put the markers, they push it away, or they go, "Oh, the sand tray. I don't like sand." That's what they say, right? But it comes with time, right? It comes with time to being able to expand yourself to those different ways of learning how to process somatically and also through art materials.
Thank you,
Well, and
Annie.
even to just begin with grounding,
Yeah, yeah,
like,
yeah,
using
yeah.
playful grounding techniques.
Yeah, and I have parents and kids bounce on the yoga ball. I have two in my office, so it's a great way to get a parent involved, make a little bit less tense situation. So
Yeah. So while we're on the topic of parents, I know that at the time of the recording, we are right before the 2021 Andrea conference, which you two are going to present on involving parents in the
yes.
work. So can you talk a little bit about how to involve parents in the process, and a little bit just kind of give us a preview of what you're going to present on in the Andrea conference?
One part that we're doing a couple of different things. One is to talk about the role of the therapist as a kind of attachment figure for the parenting system as well as the child, like how you kind of have to hold everybody in order to do successful trauma work with the child. Because I think a lot of times in consultation, we've found that this is a real struggle for people who do child therapy is what's the relationship with the parents, and what about if the parents are contributing to the traumatic experiences, or are feeding in some way. And so we talk about that, and then also kind of review of the long honored storytelling approach that was originally put forth by Joan Lovett, but just remind people how to do that and how to be creative and playful with that, kind of the way Annie was just describing, using materials and things like that. And then my favorite part is Annie's part.
Yeah, and I'll talk a little bit about that. And so it's something not talked a lot about with the EMDR with children. Like we spend a lot, many trainers spend a lot of time talking about preparation techniques, which we do as well. But there's these two forgotten phases that we don't talk too much about. And for me, it is whether kids will continue with me or not. And it's the closure phase. And I'm talking about closure with parents. It's preparing parents for after the reprocessing phase. So a kid leaves my office, they go home, they regress a little bit, and then a parent doesn't handle it well. So then we have a child who pairs, my EMDR session with getting in trouble at home. So I work a lot to prepare parents in closure. And then I really work with parents on giving them a chart of what happens throughout the week. So, what kind of symptoms are you seeing? Are you seeing more regression? Are you seeing improvements? But getting specific from parents. So, that's part of the workshop is just really teaching therapists how to engage parents to get accurate information for reevaluation phase. Because I can't do any more processing unless I know what's happened that week,
Right.
right?
I have to say, the more I talk to you, the more I get jealous about your your work with children. Because I wish I could talk with, the spouses or the partners of my adult clients to,
Yeah.
to support them after a processing session that can be really intense. So, I mean,
Yes.
I guess it is kind of like an advantage of working with
Yes.
children
Yeah.
that you
Yeah.
get, you
Yeah.
have more members on your team.
Yeah.
Yeah.
Absolutely. I
And
like,
also, kids are really bad at reevaluation phase.
yeah.
They just no. That's really one of the greatest challenges of doing this work, especially because we end up doing it in small,
Yeah.
tolerable bites.
Yeah.
Is how do you know when you're done?
Yeah.
How do you know where we are? And because it's hard enough for our adult clients to do that kind of self-reporting, but it's really developmentally out of reach for children to reflect on themselves and decide how much something still bothers them is really quite a leap. So
Yeah.
we need the parents.
Yeah.
Yeah.
Definitely.
Okay, so I want to ask you. I know that the two of you, teach basic EMDR training with an emphasis on how to work with children, which I know that generally the basic EMDR training doesn't, dedicate a lot of time to how to work with children. So first, I want to ask you, what are the major challenges that you see if you maybe when you get consultees who came from other trainings? What are the major challenges that you see for EMDR therapists who've been recently trained in how to work with children?
Yeah, I mean, that's a really great question. So some feedback that we've heard is that um, so let me stop there. So every EMDR trainer has to train it in the adult protocol, including myself and Anne. So we are under Andrea standards and we have to train it that way. So, but what other participants who come to some of our more advanced workshops will say, there wasn't any suggestion on how to do this with children. And so that, in part was why we really started to offer the fundamentals. Uh, you know, workshop because folks would end this EMDR basic training and then they would come to learn from us for 8 hours about how to do this with children. And so we do incorporate this in our actual EMDR basic training. We make room for it. We actually add on extra hours. We just feel it's important. And of course, then we have many play therapists who attend our training, so they're expecting that. But what I say to the adult therapists is listen closely because what I teach, what I'm teaching you, what I'm teaching therapists to do for children, you might actually use these interventions for adults, right? Remember when we are doing EMDR processing, our clients could be in a child state, right? I had a client today who, right in front of me, she's a 35-year-old woman and, changed into a 5-year-old, right? So I have to change the way I operate, right? So I think it's just important across the board for all therapists to understand this.
Yeah.
And the other thing, of course, is we tell our own case examples, which include children and teenagers. And so that's when people are looking for basic training, it maybe makes sense to pay attention to who the trainers are and how closely they align to your population, because it's really hard for someone who doesn't see children to give you case examples about how to apply. Because I think that's really where it gets, tricky is the how to, because kids are not, they're moving target and it's not as easy. I mean,
Yeah.
even with my consultees, I'll sometimes say, okay, get good at the protocol first
Yes.
with either very obedient children or teenagers or adults before you try, a hyperactive 6-year-old, because you're going to have to be quick on your feet if you're going to get any of this done with them. So,
Yeah.
but those are the realities. Child therapists are already, like, we get a lot of child therapists are already very, very good therapists
Yeah.
who are
Yeah.
trying to add EMDR to the mix, and they deserve some depth in terms of how
Yeah.
to apply that, and it's needed right away the first time,
Yeah.
the first time you try it. So
Definitely.
Yeah, I definitely agree that people should look into who the trainer is and what their specialties are. When I used to do participate in basic training as a consultant in training, I used to say to people that, if you work with children, I'm not your person because, pick one of the
Sure.
consultants who do regular work with children. So the
Correct.
same thing can be applied to the training itself. So you incorporate more of the EMDR work with children in your basic training. So
Correct.
naturally, play therapists and child therapists would be inclined to your training. So I want to transition our conversation a little bit into more of the processing of EMDR with complex and
Mm.
developmental trauma. And what do we need to take into consideration when we do this more complex trauma work with children?
Yeah.
yeah, both of us kind of froze there for a minute, which is exactly what it's like.
Yeah.
Right? So those are the realities.
Yeah.
I know, well, Annie wrote a chapter in our book was specifically on dissociation, so let her
Right, that's
kind of
chapter 8 in your book.
weigh in with that. But the other piece I think is really good consultation, child specific consultation, if that's your population. We get some people even in basic training who are like, yeah, all my cases are hard cases. So,
Yeah.
and we've started, our website is Playful EMDR, and we have groups, we have CITs who are kind of in that mix, like understand children, complex trauma, and play therapy. sort of the, how they get into that group to work with us. But so consultation and careful case conceptualization so that you recognize when you're already in the traumatic memory network, because it's kind of everywhere for a kid like that. It's in everything they play, it's in everything they say. And it's just, trying to construct something coherent that then would be amenable to the protocol and a little bit at a time. But Annie, why don't you talk about
Yeah,
your approach with dissociation?
I have a couple of things I'm thinking of. One is our EMDR trainings are now filling with people who, like Ann said, only have hard cases. So something else we're doing in the basic training, as well as, of course, our advanced trainings, is really opening up the topic and exploring attachment and dissociation. Of course, the EMDR basic training is for a certain purpose, but we feel it's really crucial to at least open that door, right? Have a conversation. Do you know, show a few slides around attachment, if you show some slides around dissociation. We show, I know we're getting to the dissociation doll, showing that, giving options. And so, with these kids, it's complex to work with them. I've actually said to Anne, I want to put like a PowerPoint for parents. And I actually just had a parent who asked me, she said, will you just put together something so I understand this trauma, this dissociation? It's actually the adoptive mom of that boy who wanted EMDR. He was foster care for 4 years, and of course she's challenged. And so she's like, but I need more material. I don't know what you're talking about when you talk about parts, right? So I've actually been putting things together to start to show parents a little bit more detail about this. And I think it's so, for a therapist, you have to know how to soothe and ground, right? You have to playfully soothe and ground. You have to know that. You have to know the protocol very well. You have to know how to prepare a child for that protocol, preparing them for, do they know their emotions, their body sensation, what thoughts, right? We don't give them the negative belief sheet like we teach in the, in the adult client,
Right.
right? We have to come up with negative beliefs that fit them. Like, I don't like myself. I'm yucky, maybe I'm not good enough. So it's preparing all that before you get to that place of processing a trauma. And then it's naturally occurring because kids, and I'm going to kick this back to Anne after, but kids are naturally playing out their scenes in the sand, in the dollhouse, in the playroom. And
Yeah.
it's for us, this boy was prepared enough. He was ready. He put it out there on the table that he wanted to talk about this, work on this. And we playfully, with adopted mom, worked on that trauma of his past with bio parents. So many components to know. And that's why a new EMDR therapist feels so overwhelmed. And like Ann said, you need consultation, right?
Absolutely. I'm wondering, just to make things a little more complicated, how do we do parts work with children? I know it's something that a lot of adult EMDR therapists are struggling with, or it can be challenging because we're learning EMDR, we're learning so much information in basic training, and then on top of that you add parts work. So if you're not trained in IFS or ego state therapy, how do you integrate parts work to
Right.
working with
Yeah.
children, and how is it different than working with adults when we're doing parts work?
Yeah. You want to go first, Ann?
Yeah, let me just say something. So, in a way, I think we've been certainly in play, that's been happening all along. So, play therapists see the play as a projective space that has the self there. The baby, a child's playing with a baby doll, that doll's also them. It's also their child, their baby self, right? And I've had a lot of kids who are both the hostile caregiver, introject, and the nurturing figure and the baby all in the same session, right? So some of it is more happening in the mind of the therapist than it is. I think it's already there in the room,
Yeah.
and that's true with our adult clients too. It's been there all along in these kind of shifting ways that people relate to us. but it's about having a lens for the therapist that makes it make sense. And then starting to, kind of build that language with the kid or, or the adult. We always talk about Inside Out, the Pixar movie with the
Oh
little
yeah.
emotional parts, right? And what a gift that was.
Yeah.
So there, that's maybe a very simplistic approach to it, but having kind of tangible, playful ways of sort of personifying, either in dramatic play, like I use a lot of puppets
Yes.
for that sort of thing. Some people use Sandtray, other options. But anyway, so I think it's been there all along,
Yeah.
but it's partly about having a shared language, especially for older kids.
Yeah, and I know that the two of you created a new tool to introduce the idea of parts to children, the dissociation doll. So I'm wondering if you can talk a little bit about it.
Yeah. Allmee. That's what she's called. Allmee. So Allmee.
Because all the parts are me.
Yeah. So yeah, she's a doll, and you'll see a picture of her. So she's a doll that one doll with parts inside her head. There's a flap. And so there's, an angry part, an anxious part, a sad part, a happy part. And then inside her heart, there's one more little doll, and that's the most wounded part. And so children just naturally gravitate, they pull them out. And I had one kid pull all um, the parts out, and he looks at the anxious one. He goes, "That's me. I am nervous all the time." Right. So there's the discussion. You have a nervous part of you. Could you tell me more about that? When do you get nervous? Right. So they're leading it. It's often they're leading it, and we're just waiting, right? I'm waiting a lot of times, and then they say something like, or in the sand. I had a 4-year-old girl. She has lots of medical issues, and when she has medical problems, she of course regresses, right? And so came into and did this beautiful sand tray on her own. I just didn't say a word about the sick girl and then the healthy girl. And of course, the healthy girl was in this beautiful, Corvette, and just driving around town, having a great time with friends, and the sick child, right? And then I could see them like arguing, right? I couldn't understand it always, but then, I just one day I said, I wonder who's going to win. And she goes, this one, and the one that's healthy. Right. And it was just a beautiful moment. Right. And she played a similar scene out for weeks and weeks and weeks. And interestingly, her medical problems have really diminished. We just had a wrap up session yesterday. Mom says she's doing great. Right. So interesting how, taps into some of the body's healing power. So parts work is just we have to have many tools, and Allmee is one of our new tools.
And just to say a word about Almi, so we were originally inspired by the work of Fran Waters, whom a lot of people know, the author of Healing the Fractured Child. And Fran has such a doll. And then we worked with her and got her permission to sort of pursue this. And now there is a company that's going to make them. And we're so excited about it. And they're just starting to go into production.
Yeah.
Yes,
But
and
we all owe a
we
debt
will
to
link
Fran
in
because she
the
was really one of the first dissociative first people for children. So.
we will link below this video to the dolls if people want to take a look at the doll and see what it looks like. They can find a link below this video. Anna and Annie, can you talk a little bit about your workshops that in courses that you teach? I know you offer consultation groups specific for EMDR therapists who work with children. So, where can people find you, and what kind of courses, workshops, and consultations do you offer?
You want to go ahead? You go first.
Sure. Yeah. So first of all, we Andy and I this year started a joint website. It's playfulemdr.com, which is becoming our sort of home, our hub for all of this. We do this fundamentals of EMDR with children, which Annie was just mentioning, which is kind of it's an 8-hour sort of whirlwind tour, the basics. We teach a lot of fun bilateral stimulation, which I brought my magic wand, my blinking magic wand. because we both believe in you need lots of different options in order to keep things moving and to keep kids engaged. So we teach some of that. Those are all online. And then we have a distance learning, like a self-paced module, which is based on webinars that we hosted during the early pandemic with a bunch of people who were contributors to the book. So these are all, by and large, play therapists who are also EMDR consultants or trainers. And so, they have a lot of fun interventions as well as giving their kind of conceptualization about how to do this work. And also one's on art therapy as well, with one of our colleagues. So that's all now in a self-paced format. So people can work through those as they want. And then do you want to say something about the
Yeah.
spring and
So
the dissociation? Yeah.
yeah, I want to say a couple of things because there's a forgotten population in the kid world, and it's the teen population. And so we absolutely, that was my first population. I dealt with teens who committed crimes, getting in trouble with the law, probation. And, that's one of our big case examples of how to work with really challenging, difficult teens, because I know many therapists out there really struggle with that. And so that's being playful, but also finding ways to address the developing young adult, right? So that's addressed in all of our workshops. And so, one of my really important things that I'd like to see, for Anne and I to really help the EMDR with children clinicians is learning more in depth about attachment dissociation, but learning it experientially. So, oftentimes we teach many different interventions and we give people time to practice them, but they don't have enough time. So next year, in 2022, we're going to have a more extended version so people can come virtually, be able to practice, ask questions, share cases, and just get into our working minds of, Annie, how do you do this? And how do you work with a 4-year-old? Can I ask about my case, right? We want to make it more like that. So,
Excellent. A lot more
Yeah, so it's
experiential.
4 different days. It starts in May, and we have saved the dates up on our website, but we're still working on, getting the whole registration rolling.
we have our SUD scale. We have very playful SUD scales. So we could come play with my SUD scale, wrote them, my yoga ball. What else you want? Puppets?
I
Excellent.
got a lot of right here behind this computer. You have no idea how many things I have here. I
There we
have
go.
like I have Meaty who has a
Yeah.
he has sad face on right now.
Yeah.
So we try to make it fun. If people don't know anything about play therapy and they're interested, I'm also a play therapy trainer,
Mhm.
and they can find me on the web at annebeckleyforest.com, and I do basic play therapy trainings to introduce people who don't know play therapy at all. So,
I have one more thing to add to that. We are always looking for CITs who share our vision. And so if you come to Playful EMDR website, you'll understand our vision. You can partake as a CIT. We are really good consultants and you're going to work hard. So, it is about, you're going to assist in our EMDR trainings. You're going to run your own, consult groups. We're going to watch, but we make you a really, really strong consultant. And so it's not for everybody because there's a lot of work. But those that come to us really want to be that person. They want to be really good.
and we kind of
Excellent.
think that the answer to bringing these worlds together of play therapy and EMDR really is in cross training and having leadership on that, and that's our vision for inviting people to be consultants and training.
Yeah.
Excellent. So, Anne and Annie, before we say goodbye, one more question. And actually, I want, this is a question I ask every person I interview. And I was wondering if I can ask both of you slightly differently. So, the question is, how do EMDR therapists get better at being EMDR therapists? And maybe one of you can answer the question as is, and the other can answer, how do EMDR therapists get better at being EMDR therapists for children?
I can answer the first one, Anne, if you want to do the children. Yeah. I maybe I'm going to add something or say something a little unusual or what people are thinking, but I'm a really good EMDR therapist because I really do a lot to take care of myself. So, and I know we all talk about that, um, but I think it's really a missing part of how to be really, really good at what I do. Is that I do a lot to, I do traveling, I do sports, I shut the phone off, and in part why that is, and yeah, thank you for the thumbs up. But in part, why that is, and I say this to parents that I work with who want to text me on the weekend, is I say, I have to let my mind refresh. And if my mind refreshes and really gets clear of the week, I can then come up with new ways to help solve your problems at home with your kid. And I sincerely mean that. It's not a line. It's when I shut myself off, I take a hike in the woods, I kayak. It's then that I get back to my work and I go, I know exactly what I'm going to do with this kid. Right? And my cases are hard. I got DID teenagers, DID children. Like I have to be the most grounded person. So of course I can tell you to go get a consultant, of course, but everybody knows that. And that's money, right? It's not money to walk outdoors and touch a tree. So, so
And to leave your phone at home. I really love that you said that.
yeah, I think it's this we're missing what it means to be really and get away from your work. People say, Annie, you're so busy, you're doing so many things. How do you do it? And how do you still have a life, right? And I say, because the reason I can work a lot is because I do have a life, right? And I'm not burnt out, right?
Yeah.
That's such a good answer for my question too. I think kids will smell a fraud coming from a mile away.
I
So I
love
think
it.
that's really good advice for them as well. And the other one is something my grandmother used to say to me, which is make haste slowly.
Mm,
Which is it really takes time to establish a relationship of trust with a child, especially a child that's been fixed up by foster parents, teachers, school counselor, pediatrician. By the time they get to me, there's been
yeah,
a lot of players here.
yeah,
And so we start in a kind of deficit position in terms of an authentic, kind of egalitarian relationship
yeah,
where things can emerge. And, I can trust that this child's also going to say, oh, this is too much for me today, which is so essential to having emotional safety in trauma work. So in
yeah,
addition to bringing a very grounded self, as Annie was describing, also understanding that it takes time and that
yeah,
we don't want to come in highly directive, even though we have this great protocol that we know is going to help, because it'll backfire. So
yeah.
Right.
that's where the play comes in.
Thank you. And Beckley-Forest and Annie Monaco, thank you so much for your time. That has been wonderful.
Thank you.
Thank you.